Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte places Metro Manila, Davao City, and several other areas under the general community quarantine until the end of 2020. Ahead of the Christmas rush, experts warn that coronavirus cases may reach 500,000. What measures are in place to prevent another COVID-19 surge? And will the health department look into government officials allegedly involved in events violating health protocols? Health Secretary Francisco Duque III joins us live. Metro Manila residents will be celebrating the Christmas season under general community quarantine, which has been extended again until the end of the year. President Rodrigo Duterte also placed 7 other areas under GCQ. These are Iloilo City, Tacloban City, Lanao del Sur, Iligan, and Davao City, Batangas, and Davao del Norte. The president explains there have been violations in health protocols, yet he defends the easing of some restrictions on mobility. Here's the president in his own words.
Bakit rumami? Bakit hindi rumami na lumabas na ang lahat? Bakit? Mapigilan mo? Papiliin na ng gobyerno? Mapakain ba ng gobyerno ang lahat? Yan ang istorya dyan. Kung hindi sila maglabas ng bahay, can you sustain their lives while inside the house? Nobody's buying food, hindi nakikita, walang trabaho, wala lahat. Kaya napipilitan lumabas.
Let's go straight to the source of the story. We have Health Secretary Francisco Duque III. Secretary Duque, good to have you again on the source, and thank you so much for your time.
Hi, Pinky. In behalf of the DOH, I'd like to greet you and all your viewers. Indeed, the most pleasant and productive day.
The president already announced that Metro Manila and other areas will still remain under general community quarantine until the end of the year. Secretary, what were the factors that made the IATF recommend this to the president?
Well, the status quo, the general community quarantine, the IATF thought it best to maintain it. Para naman nang sa ganon, pagsalubong natin, if we celebrate the Christmas holidays and the New Year, there should still be a measure of caution. There has to be very important, the sense of consciousness, awareness of people that during this holiday season, there will be more people going out and therefore increasing contact rate and also the transmission rate. And there could be a potential surge of cases. And to keep it at this GCQ community quarantine will hopefully forestall or prevent that surge from happening.
Yeah. And Secretary, because there's that fear of a surge this holiday season, did you even for a moment think of possibly stricter measures to impose?
Yeah, that could have been an option, but we are governed by data. And so the IATF is evidence-based in most of its decision-making process. And so our expert, our data analytics expert group has given us this set of recommendations. So, yun yun. But of course, what is important is the readiness of the health system capacity. So we continue to enhance our health system's capacity by way of increasing our isolation and quarantine beds and facilities in general, the hospital critical care capacity, which means increase isolation, ward beds, ICU beds, and also ensuring there's available or adequate mechanical ventilators for critical cases of COVID. So we're on the lookout for all of these, and
Okay.
we're prepared.
Are you at all worried about a spike this holiday season?
Of course, there's always that fear that what happened in the U.S., in Europe, the some in second spike, and so that could potentially happen to us, and that's why we need to really drill down over and over again. In fact, by way of our going down to the LGUs, last week we visited Davao City and met with the private hospital representatives and, of course, the LGUs to remind them and to guide them as to the effective implementation of the 5 pillars of our pandemic response, which are number one, prevention by compliance with the minimum health standards of wearing face shields, face masks, social distancing of not less than 1
Social
meter, and the
distancing.
greater the physical distancing, always the better, and frequent use of alcohol or sanitizers and disinfectants applied to inanimate objects. And so these are some of the reminders. And then, of course, the detection component of our 5-point strategy is really through aggressive case finding, isolation, contact tracing, quarantine, and also readiness to treat our severe and critical cases in the hospitals. But hopefully, we don't have to get to that point of patients deteriorating into life-threatening, if not life-ending complications. So we have the COVID, the code team that went to the that goes to the different regions, no? And we did that for the whole month of September, October. We went down to the different regions, different provinces in the epicenters, NCR, Region 4A, Region 3, and then, of course, in the Davao region and some areas of the Visayas. No? And these interventions have proven effective. No? And that's why you see now a rather steady low number of cases, if not a continuing downtrend in the number of cases by monitoring, of course, the average daily attack rate and also the 2-week growth rate, and also monitoring, very importantly, the critical care utilization rate.
Yesterday, Secretary, I heard you tell the President during his address to the nation that we are looking at a possible spike in COVID-19 cases because of the holiday season. That's not exactly what you said, but I remember you saying that to address this, we are readying facilities. Are there new facilities that you're looking at to be able to address a possible surge?
Yes, in fact, we've increased our capacity tremendously from the initial stage of the pandemic, sometime in February, March. I recall our isolation quarantine facilities were only about 6 to 12, and now we're over 10,000, and the bed capacity is about 168, 170,000. But of course, with some slight decrease on account of the damage caused by the three successive typhoons, Quinta, Rolly, and Ulysses. No, and then our testing
Yes.
capacity also. We have done a great deal in terms of increasing testing output. We have now tested 5.8 million people, and our daily testing output has been increased to about 30 to 30,000 per day. So these are indicators of
Okay.
progress that we have made in making sure that our capacities are increased, enhanced, to be able to manage and be able to manage any surge in the cases of
Mhm.
COVID-19.
What I want to know, Secretary, is there anything new or any facilities or any methods that will be implemented to prevent a surge this holiday season? Meron ho bang bago?
Well, essentially, pareho naman sa dati natin ng ginagawa. Pinapalawig lang natin ang kapasidad,
Mhm.
pinapaigting natin ang
Okay.
monitoring, surveillance, no? So, yan ang patuloy naman yan eh. This is a work in progress, Pinky. You cannot say that, okay, at this point, this is it.
Mm-mm.
Although, of course, our goal is very clear. Number one is to make sure that our attack rate is below 1%. Our 2-week growth rate should be below zero. Anything below zero, of course, that means negative value. So that means there has to be a appreciable decrease in the number of confirmed cases for the current 2 weeks compared to the previous 3 to 4 weeks. And the
Okay.
number
And
of the death per million in the Philippines is
mm,
has been at about 74 per million, and that puts us at ranking of 125 among all the countries of the world.
yes, and you've already made it clear, Secretary, together with other government officials, during this holiday season, no caroling and no Christmas parties. And if there are going to be parties, I believe the gathering must only be until 10.
Yes, and the Christmas party has to be limited to immediate family members, Pinky. Ayaw nga natin, we discourage, dissuade people from inviting even relatives
Yeah.
coming from different places. So we should never know. We've seen already, as clearly pointed out, that
Yes.
you can be going around merrymaking, but you're harboring the virus. And nobody even knows that it's possible that, the person doesn't even know himself that he's harboring the virus, and he could be spreading it, no, unwittingly. So let us be cautious,
Mm-mm.
and let us be very, very aware of the possible surge during the holiday season, and also during the welcoming of the new year. So mahaba-habang pagdiriwang ito, but
Mm-hmm.
we have to be careful. Otherwise, if
That's
we
true.
squander our gains, no, Pinky, what's going to happen is we'll end up people in the hospitals. And what a way to celebrate. Paano ba naman yung pagdiriwang
Mm-mm.
natin ng Pasko, ng bagong taon mo sa
Mm-mm.
ospital, mamaya sa ICU pa. Di ba? Bandang huli ang pagsisisi.
Yeah.
So, matuto naman tayo. At sapat naman po ang ating mga
Okay.
paalala na binibigay sa taong bayan, yung bida solusyon, 'di ba, ng DOH. Lagi po natin 'yan na paulit-ulit na
Mm-hmm.
ibinabahagi. Ang bida ang may disiplina ng DILG, ang 7 commandments ng DOTR, ang ingat buhay para sa angat buhay, yung mask, iwas, hugas ng PCOO. So we're replete with all
Opo.
these very
Okay.
important public health advisories and reminders, and always for people to really internalize these reminders as we pave the country towards the new normal. So we do all of things,
Right.
gawin natin habit. So the new normal becomes second nature.
And because of all those reminders, Secretary Duque, that you had mentioned, the gathering of Secretary Roque and Senator Pacquiao last week, I need to ask you your thoughts on that. Was that a clear violation? But we'll need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque III, Secretary. So, you have Secretary Roque and Senator Pacquiao attending a gathering last week. Were those clear violations on the minimum health protocols imposed by government?
Well, I have been hearing conflicting statements with regard to that. But the Secretary of DILG has already spoken. And in fact, he has already publicly mentioned that an investigation is forthcoming. So let's leave it at that. I wasn't there, so I cannot really say whether what is being reported is validated by those who were actually there. And you correctly pointed out Secretary Roque was there. But if I were to look at yung isa, ayan, medyo magkakatabi nga. And clearly, from my standpoint, parang hindi sumunod doon sa physical distancing na lagi natin paulit-ulit na sinasabi.
Yeah. I mean, of course, we weren't there. That's a given. But when you see something like this, that's pretty clear to you, Secretary, because you are espousing a 1 meter distance. You are espousing masks, shields. The DOTR, before nagkaroon pa nga ng conflict with the DOTR, ilan ba dapat ang metro sa public transport? Of course, pwede naman, there's a difference there between air-conditioned and non-air-conditioned. But when you see something like this, mali po ito. Yun lang po.
Yeah. Pakiulit. Ano yung huli sinabi mo?
Ito pong nakikita natin yung nakikita po natin with the Secretary Roque. Clearly, sir, mali ho ba ito?
Siyempre, labag yan doon sa atin na minimum health standards, no? So, yun naman, nakita mo, walang 1 meter nga, no? Pero, ika nga, what's the point? The point is, we can see that there's been a violation, flagrant at that, ano? As I'm looking at it now, Pinky, no? So, dapat talagang paigtingin pa ng mga pamahalaan lokal and enforcement agencies ang compliance to the minimum health standards. But ang maganda lang naman, nakikita ko, naka-mask, tsaka yung iba naka-face shield. No? So, that will still give you a significant protection.
Yeah, but you never said as long as you wear a mask.
Dahil nga open air, ventilation, so nag-isip yung iba na pwede magluwag. Dahil ang pagkakaalam din ng mga tao, kapag sa open air or well-ventilated ang lugar, ay mas mababa ang tsansa na magkaroon ng hawaan. But the DILG will investigate, and let's leave it at that, Pinky.
Yes, I know that. Secretary Anyong, I was saying we call on the public during a radio interview. He said this, we call on the public, including government officials, if you have activities and you cannot implement health standards, particularly physical distancing, stop it. Do you echo that, sir?
Yeah, huwag nyo na ituloy. Huwag nyo na umpisahan. If you cannot ensure that physical or social distancing cannot be observed. Because, it's just going to raise the risk even more. And therefore, a potential surge might be in the offing.
Yeah. Kasi, Secretary, it's really good to clarify this because kahit na nga po open air and ang dami pong health protocols that we are imposing among ourselves, all of us, sir, tell us, what is the protocol? From you na, ano ho ba ang protocol kapag open air?
Well, pagka open air, syempre, it is always better to be conservative and to err on the side of caution. That's a principle that I always espouse since I became a Secretary of Health. So, bakit pa tayo magluluwag or why should we be complacent? Kasi kung sasabihin mo, you rationalize everything, you say, pwede naman to, pwede naman yan, konting ganito, konting ganun lang, konting palugit, until bandang huli, when you get sick and it's even critical or severe, or a loved one or a member of the family gets sick, then you start blaming yourself, di ba? What a pity that will be, no? So instead of having a very meaningful, very introspective celebration of Christmas, ano nangyayari dyan? Mamaya magkakasisihan pa, bakit hindi sumunod? Ay ngayon, ang laban dito, ang akin pakiusap po sa ating mga kababayan, ang laban sa COVID-19, hindi po ito laban ng gobyerno lamang o ng national or local government or ng mga iba't ibang mga grupo.
Laban nating
laban
lahat,
ito ng
Sec.
bawat Pilipino. So kung asa sa atin po yan, pero magandang mag-iingat tayo. At in fact, sa pag-iingat natin na yan, Pinky, ang
Secretary,
daming value add. Bumaba ang dengue by I think 70-80%. Ang dengue cases bumaba comparing 2019 January to November and same period for 2020, bumaba ang dengue, bumaba ang acute diarrhea, bumaba ang leptospirosis, bumaba ang cholera, ang typhoid. Halos lahat bumaba, anywhere from 40 to 90%. So, daming value add po ng atin pagsunod sa minimum health standards. So, huwag po natin kalimutan na naibsan din po ang mga ibang mga communicable o mga nakakahawa pong infeksyon.
Secretary, we need to take another short break. This is The Source on CNN Philippines. Please stay tuned. So, Secretary Duque, I wanted to ask you about, I hope we still have time for another topic. Now, yung face-to-face classes, of course, this is not approved by the President just yet. But is there a point you think, or what factors would make you consider recommending face-to-face classes to the President? Kasi sabi po nila, Sec, merong sabong at meron naman yung tourism, yung mga bata, pinapayagan na rin pong lumabas ng Metro Manila at umikot po sa Pilipinas.
Well, yung face-to-face ay my position on the matter is kung ang lugar naman ay COVID-free for I think 2 weeks or 4 weeks. I'm not sure, no. But zero case, walang COVID, walang risk halos, mababa ang risk. Baka doon pwedeng pagbigyan. So basta very low risk or minimal risk, no. I think that should be considered in the decision whether face-to-face classes will be allowed. But notwithstanding allowing it to proceed or to happen, the minimum health standards must always be top of mind in the conduct of a possible or resumption of face-to-face classes.
Secretary Duque, I wish we had more time because I wanted to talk about the vaccines, pero naubos na po yung ating oras. I'd like to thank you for your time, Health Secretary Francisco Duque.
Thank you, Pinky, and we hope to see you again and probably tackle the vaccines more thoroughly.
Yes, sir. Let's do that next time. Maraming salamat po sa inyo. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines. So, Secretary Duque, I wanted to ask you about, I hope we still have time for another topic. Now, yung face-to-face classes, of course, this is not approved by the President just yet. But is there a point you think, or what factors would make you consider recommending face-to-face classes to the President? Kasi sabi po nila, Sec, merong sabong at meron naman yung tourism, yung mga bata, pinapayagan na rin pong lumabas ng Metro Manila at umikot po sa Pilipinas.
Well, yung face-to-face ay my position on the matter is kung ang lugar naman ay COVID-free for I think 2 weeks or 4 weeks. I'm not sure, no. But zero case, walang COVID, walang risk halos, mababa ang risk. Baka doon pwedeng pagbigyan. So basta very low risk or minimal risk, no. I think that should be considered in the decision whether face-to-face classes will be allowed. But notwithstanding allowing it to proceed or to happen, the minimum health standards must always be top of mind in the conduct of
All right.
a possible or resumption of face-to-face classes.
Secretary Duque, I wish we had more time because I wanted to talk about the vaccines pero naubos na po yung ating oras. I'd like to thank you for your time, Health Secretary Francisco Duque.
Thank you, Pinky, and we hope to see you again and probably tackle the vaccines more thoroughly.
Yes, sir. Let's do that next time. Maraming salamat po sa inyo. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.